Hello, my name is Francois Debrant. I'm a Senior Vice President at Signify Health, and I'm here to talk today a little bit about episodes of care, and in particular, paying for real episodes. Real episodes? What are they? Well, the reality is that in the world of episodes, not all are equal. Now, in our prospectively priced and paid episodes, we think about these and we construct them in a manner that goes far beyond case rates. And what is a case rate? Well, most people know that a case rate focuses on a very specific procedure, either inpatient or outpatient. In this case, we're showing an inpatient procedure, and we're showing also that the case rate includes both inpatient facility costs and inpatient professional costs. But again, it could be an outpatient facility and outpatient professional cost. The point is that a case rate only includes a small number of services, and really only the ones that occur during the course of that particular procedure. Now, in our prospectively priced and paid procedural episodes, we take a longer view. Why? Because we know that there are a lot of services that are expended and done on a patient for about 30 days prior to that procedure. And you want to be able to capture all of those services so that you could look for and potentially contain services that are of low value and really don't have much of an impact on the patient's outcome. And then the time window of the episode after the procedure is done, after discharge, is about 90 days. Now, for some shorter term procedures, think of colonoscopies or endoscopies, it obviously doesn't go 90 days, but for most procedures, joint replacements, cardiac surgery, etc., it extends to 90 days post-surgery. And during that period of time, we're capturing all of the services that are deemed to be relevant to that episode. That includes professional services, it can be pharmacy, physical therapy, occupational therapy, everything that occurs for that patient during that period of time that is relevant to the episode, and in particular, readmissions. And why is that important? Because today in the fee-for-service world, most employers, if not all employers, end up by paying for defects, the things that happen to the patient that shouldn't, and they end up by paying for those services. While in a prospectively priced and paid episodes, there is one price for all of these services, even if there's a readmission or a problem that occurs to the patient, and that's the guarantee that the employers get. But beyond procedural episodes, there are condition episodes. And condition episodes are important. Why? Because they extend out during the entire benefit year, 360 days. And within those condition episodes, you're going to find procedural episodes. You're going to find acute events. You're going to find all types of services that are relevant to the management of that condition. And what having a longer term condition episode does for both the patient and the employer is that it really encourages and motivates the clinician to manage that patient in the most appropriate fashion, reducing any use of services that are deemed to be of low value, reducing occurrences of procedures that have very little to no benefit to the patient, and of course avoiding any acute exacerbations or complications. So when you look at episodes, take this lens. Think about what you're getting. Is it a case rate? Is it a full procedural episode? Or is it a full condition episode that includes everything inside? And we would encourage you to really look at and ask the questions of the organization presenting these options to you so that you clearly understand what you get, because in the world of episodes, not all are equal.